number one Jolly's Walkie. We cater for everyone Jolly's Walkie. Boost up the immune system Jolly's Walkie. Yeah. Yo, Dominic is the white water box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Introducing Jolly's Pharmacy, brand new website, www.jollies.tm. It's your time to jump the line. Shop now at jollies.tm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.tm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.tm. Jollies Pharmacy, leading the way in healthcare.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. And that is JP Mega. Your one-stop shopping, Dominica, nigga. You could be shopping and having fun with your daughter or with your son. We cater to everyone. What a happy place. Oh, JP Mega. Your one-stop shopping, Dominica, nigga. You could be shopping and having fun. Bring Papa and Mama along. We cater to everyone. What a happy place. Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
A very pleasant good morning to all the listeners of Q95. You are tuned in to the one and only Health Vibes from Jolly's Pharmacy every Wednesday from 10:15 to 11:30. So this morning, 2 of our very special people are not here with us. Mr. Carlton Lando is conducting clinic sessions with us, and Miss Trudy Christian is also out focusing on other commitments. So I will be on with you this morning, yours truly, Jacinta Fagan Defoe, and I have a special guest with me who I will introduce after our break. Now we know that school reopens next week, although college started this week already. And I'm sure, the teachers, principals, students are all excited, after the summer break. And I'm hoping that they got some time to enjoy the summer, enjoy the weather, relax, sit back, especially those who did common entrance, and the CXE and any other type of exams before the summer break. And I want to take the opportunity to also congratulate all of them, who were successful. It's a lot of hard work, sacrifice, and not only the children, but also the teachers, parents, and loved ones who were there through the entire journey. Okay, so best of luck for the new school term and put your best foot forward. So at Jolly's Pharmacy, we're always bubbling, there's always something new, and it's not just for customers. There's a saying that charity begins at home. And this month, September, we have a calendar of events just for us staff. So I'm very excited about that. And we started on Monday, where staff members would come in to the gym area to take our weight, get our BMI and our fat percentage. So this is for the biggest loser challenge. So those who are interested would have come in, get their measurements and their weight, and then in 1 month, so at the end of the month, we would decide who lost the most weight. So it's excitement for staff members. And throughout the month, there's eye clinics, dental clinics, yoga sessions, cardio jams, football games, movie night, and talent night. I'm very excited for the talent night. So it's really a great initiative at Jolly's Pharmacy. We work very hard, and of course we can't be educating the public and engaging in so many activities with our customers and not doing it for our very own. Okay, so I'm very happy about that. So for back to school, I just wanted to highlight a few points in terms of health and wellness for our students, teachers, principals, and those involved in the school life. Adequate rest is very important. We know that around summertime or any break period, you capitalize on the fact that you don't have to wake up as early, you don't have assignments, exams, tests coming up. So you may stay up extra late and wake up very late. But, starting back a new school year, it's important to recognize the importance of sleep. And many of us, especially as adults, we underestimate its value. So, getting enough sleep is very important. Parents, I'm sure you have already spoken to your children about going to bed at a certain time, so that your body is well rested, your mind is well rested, so that you're able to absorb the information, that you are alert and able to retain and participate fully. Okay, a healthy diet, again, over the summer, snacks and the diet probably went out of the window, and it's understandable. You get to free up a little more. But again, if you want to be at your best, perform at your best, your diet also has to be in sync with proper rest. So staying hydrated, getting in your vitamins, your minerals, your fruits, your vegetables, just having a balanced diet so that you get the adequate nutrition needed that the brain will require and your body will require. Physical activity is also important. I know there's sporting activities in many schools, and we really commend them for that. But the one specific area I want to touch upon. So many parents come in with children who suffer from some type of scalp condition, and it's because of barbers cutting their hair and probably they getting some type of reaction. And now that school is reopening, parents want to make sure that their boys, have their sharp cuts, to get back into school. So I really want to appeal to the barbers, hairdressers, whoever is dealing with hair and scalp, that they clean their tools properly before moving from one scalp to the next, because there can be transmission of germs or whatever, the bacteria or other parasites that can be transferred from the tooth from one scalp to the next. And this is a serious problem and needs to be treated and attended to as soon as possible. So just ensure that you are a bit more diligent in doing that and taking care of your customers. All right, so just a little pointers for our customers back to school and recognizing that it's important education is key, and we at Jolly's Pharmacy, we are always encouraging our customers to take advantage of all the knowledge and educational programs out there. Okay, so we're going to take a short break, and then after I'll introduce our topic and our guest.
Woke up this morning feeling real sick. I had intentions to call it sick, but I end up in Jolly's Pharmacy. And down in the street, at least fix up my immune system. Me feeling fit and strong now, I'm ready to work and make on any mission. If you see me again, Jolly's Pharmacy is number one. Jolly's again. We cater for everyone. Jolly's again. Boost up your immune system. Jolly's again. Yeah. Yo, Dominic is the white water box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare. Introducing Jolly's Pharmacy, brand new website. www.jollies.tm. It's your time to jump the line. Shop now at jollies.tm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.tm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.tm. Jollies Pharmacy, leading the way in healthcare.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. And that is JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun with your daughter or with your son. We cater to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Bring Papa and Mama along. We cater to everyone. What a happy place. Oh, what a happy place. But just stick some more any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole, where there's lots of parking. On Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. And on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare. Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Welcome back. If you're now tuning in, you are listening to Health Vibes from Jolly's Pharmacy. So today we have a packed show, and like I mentioned, I have a guest in studio, and she is Miss Shuma Alfred. She is a cosmetologist, a trichologist, a physician in training. She's been with us, Jolly's Pharmacy, partnering in different activities for quite some time. Good morning to you and welcome.
Morning. And how are you?
I'm doing quite fine. How are you
I'm
doing?
doing well, and I'm just so happy and grateful for the opportunity again from Jolly's, Orin and his team, who are always on board. For offering me the opportunity to be here to talk about what we're going to talk about today.
Thank you so much. And I remember you a couple of years ago where you did hair and makeup. I mean, those are her specialties. For one of the contestants who went up for Miss Dominica. And I think one of her pictures, as you said, went viral because she is a very beautiful woman. But when you have that extra touch added. Oh, so Miss Shema Alfred is a very talented cosmetologist, and I really must say so. And we'll talk a little more about what that means, being a cosmetologist and trichologist, and what it means in the field of medicine and so forth,
and the beauty industry.
And the
as well.
beauty industry. And not too long ago at Mega Store in Focoli at our MVP
Yes,
experience,
yes.
she was there. I had her videos, her pictures, and willing to give out information on different types of conditions and treatment remedies. But this morning's focus is on hair, scalp health, thinning, balding, alopecia. I'm sure many of us have heard that term before. So we're going to define it, speaking about how the causes of it, the diagnosis of it, is it curable, the treatment options available, and other types of shedding or thinning scalp conditions.
Yes.
I want to point out to our listening audience that towards the end of the show, we will be asking questions, and 6 lucky winners will have an opportunity for free consultation with Miss Shoma Alfred on Friday and Saturday at Jolly's Pharmacy. Right. So you get the opportunity to have a one-on-one with her about any scalp condition, hair condition, or face concern that she is specialized in. And of course, she'll walk through with you if she can assist you and what needs to be done. And I think this is a really great opportunity, especially for the ladies out there who are so concerned about their looks and their hair and their scalp and so forth.
Yes.
So this is our focus for this morning. So let's just delve right into it. So Miss Alfred, you're a cosmetologist, a trichologist, a physician in training. So she's also studying medicine, very ambitious. Walk us through exactly what those specialties contain. What are they exactly?
Okay. So we'll start with cosmetology. So cosmetology focuses on the beauty aspect of hair, makeup, nails, facials, anything to do with beautifying the outside, So that is what cosmetology focuses on. So I am officially trained in cosmetology many years ago. And I've been a practicing hairstylist for many years. I actually started when I was 14 years. So my first summer job, I was 14 years.
Wow.
And I've never left the field. And so when I was done with college, right after college, I went to study cosmetology in Trinidad, and I've been doing it since. Which is where the catapult for more things to come came from, or it began. Because as a cosmetologist, I started noticing hair and scalp issues that I was not able to assist my clients with. So they'll ask me, what's going on with my scalp? Why it's itching, it's flaking, I'm losing my hair. And so that is what prompted me to look at trichology or trichology. And so what that is we study, it's a branch of dermatology where we study specifically disorders and diseases of the hair and scalp.
Nice.
Okay, so it's a science medical based field, and we focus specifically on hair and scalp.
Okay.
Mm-hmm.
And many people here in Dominica and worldwide,
Yes.
suffer with many scalp conditions. And like you mentioned, they may walk into a pharmacy or they may get recommendations from friends, colleagues, say, "Oh, I have something similar."
Internet.
TikTok,
Yes,
YouTube, Google,
yes.
and all the likes of it. And, just pick out something random, hoping that it will assist with the
Yes.
condition. And sometimes we make the mistake of worsening
Definitely.
the condition. And I'm sure you've seen.
Definitely. And actually, the US has mentioned that alopecia or hair loss is actually in the brackets of an epidemic. So there are billions of people who suffer from hair loss. Over the years, there has been more and more studies into hair loss, but before not so much. More or less one type of hair loss, which was androgenic alopecia.
Right.
But because the numbers are growing over the years, there have been more companies and more physicians who invest in studies for hair loss and treatment for hair loss. And so that is again where trichology falls.
Right.
Okay, because dermatology deals with broad spectrum, the skin all over
Right.
the body and so on, but we focus and we hone in on specifically hair and scalp.
Hair and scalp. And,
Yeah.
and I think, the beauty industry, cosmetic industry, and there are many manufacturers right now who are getting on board to developing products to treat certain types of scalp conditions.
Yeah.
But the scalp conditions must be diagnosed correctly, because more than one type of skin and scalp condition may look similar.
Very much
They may
so.
overlap.
Very much
There may
so.
be infections as well of different types that may present themselves. And so proper evaluation and diagnosis is very important.
Very important.
So I really love the fact that you saw the need to further your studies and gather information and educate yourself on the different types of skin and scalp conditions, along with the regular cosmetology
Yes.
field in like
Yes.
the broader aspect of it. And you've been doing it for quite a number of years, but we'll go into what you've seen a bit later. Let's try to get into the different types of thinning or balding and other scalp conditions. And you mentioned very early alopecia. So let's
Yes.
define what it is, and we'll go from there.
Okay. So I just want to say it's Alopecia Awareness Month, September.
Yes, it is.
So we have a month dedicated to disseminating as much information as we can about hair loss. So we'll start with alopecia. So we have clients and patients who come in who say, I have alopecia, what can I do? And I'll ask them, okay, what type of alopecia do you have? And they usually look at me like, type of alopecia? And so yes, so alopecia is an umbrella term for hair loss in general. Okay, and what it is a disease process of the hair follicle. And so the hair follicle is a very complex network on the below the surface of the skin. And so that network, it encompasses receptors for hormones, cytokines, and there are blood vessels that feed each follicle.
Okay.
And so whenever someone is experiencing hair loss, we have to look at these different areas.
Right.
Okay, because it's I shouldn't say never, but it's almost always not attributed to just one thing. Okay. So so alopecia is a disease process that affects the hair follicle, and as a result, we lose hair. Okay. Now there's a difference between hair loss and hair shedding.
Okay.
So hair shedding is a natural process. We shed hair. And so based on the cycle of hair anagen phase, catagen phase, telogen phase. There is a growing phase, resting phase, shedding phase.
Right.
And so it's a natural process. So it happens at different points on the scalp at different times. And it leads me to talk about as well the growth phase. And so the growth phase and the growth duration. So that is genetically predetermined. Okay, so during the anagen phase, which is the phase that the hair grows, my duration may be 3 years, your duration may be 5 years, 6 years. And so what happens is that your hair would tend to grow longer than my hair. And that is very, very important.
Okay.
Because we a lot of the companies now who manufacture products, they tend to market products to grow your hair, long hair.
All right.
But long
Yes.
hair is genetically predetermined. It's not something that you can affect with topical treatments.
I'm going to interject right there
Sure.
because I really believe there is a misconception
Very much
about
so.
this. And I can admit that I am one of the guilty ones who believe that, topical treatment of different oils, especially when you have the wide range of the different combination of oils, and you massage your hair, you have the inversion method, turning upside down for a few minutes. and
Wow.
Mhm.
I learned something today.
Yes, because as sources
Mhm.
have indicated that with the inversion method, you are increasing the blood flow
It's called
to
stimulation therapy.
right. And then, the different types of treatment options, especially as the topical treatment options, we're of the impression that, if you do it as frequently as possible, that your hair will grow a number of inches throughout the month. So now you're correcting us and saying that this is misinformation and
Very much so.
misguidance. So are you saying that none of those remedies would at least increase hair growth to some extent or aid?
Okay, so it's a thin line between stimulating hair growth and increasing the growth period.
Okay.
Okay, so if you've experienced hair loss, whatever type of hair loss, one of the treatment therapies is stimulation therapy.
Okay, so that's for hair loss.
Yes.
All right.
So hair loss, like it can be shedding as well, but there are different types of shedding, which is
Okay.
abnormal to what you would experience on a daily basis. So on a daily basis, we shed about between 50 to 100, 150 strands, or I would more or less say 100, 150 strands per day.
Okay.
Okay, so that's what normal shedding is. So the abnormal shedding is where we lose more than 150, and then there is a delay in the anagen phase. So there's a delay in the restart of the regrowth phase.
Okay.
So normal shedding, it sheds, and then the anagen cycle begins again.
So why do we shed?
It's just part of the process because hair, it's an accumulation of cells. It's an accumulation of dead cells. And that's where we say hair is dead.
Okay.
So it's an accumulation of those dead cells. So as the cells are accumulating, it's going to penetrate and come out through the surface of the scalp,
Right.
of the follicle. It grows,
Right.
and then it falls out, and then the process starts again.
Okay.
So I don't know how to describe it on layman terms, but it's just part of the cycle.
Okay.
Similar to our skin.
Right.
We have cells on our skin that we shed every day,
Right.
and we wash it
We
off.
wash it off.
So
Yeah.
it's
Take
the
that
same
skin.
process.
Yes,
It's
it's
the
true.
body's process of eliminating what is not necessary anymore, and it's the same with the hair.
Okay. So in the case where you mentioned your hair may grow longer than mine, but you still experience shedding.
We all experience it.
Right. Well, right. So right. So we all of us experience shedding, but then your hair. Okay. So let's say you and I have the same hair type, quote unquote, and we both experience shedding, but then you are able to retain your length, and then that's a concern again of many customers, and
Yes.
you know,
So the retention is different from growth.
Okay.
So retention has to do with what you do topically to the ends of your hair. So we'll use black hair because our population is majority black. So we'll use
Right.
black hair. But kinky hair likes moisture. It thrives in moisture. And the reason is because the sebum on our scalp, which is our natural oils,
Right.
its purpose is to lubricate and to coat. But because of our kink and our coil, the oils don't get throughout the strand of the hair to lubricate and coat. So black hair tends to be more dry and brittle at the ends than Caucasian hair or Asian hair.
Right.
And so what we do in order to mitigate that is we put on moisturizers and conditioners and oils. So once that is done, the hair is not dry. And once if it is dry, then that's where we run into things like split ends
And
and knotty
breakage.
ends, and that is what causes the breakage
Okay.
and prevents you from retaining the length. But that in itself is different from what is happening below the surface of the
Okay.
skin. So that is where I shouldn't say we can't do anything about it. We can,
Right.
but in terms of the length, because the growth phase has a duration.
Right.
So the anagen phase, like because I said it's genetically predetermined.
Right.
My growth phase is 3 years. Your growth phase is 6 years. So you have 6 years of growth on me. Because
Right,
after
complex.
my anagen phase, I go into resting and shedding.
Right.
But you're still there processing in the anagen phase. So
I
your
understand.
hair will naturally grow longer than mine.
Okay.
You understand?
I
Right.
understand.
So that is the difference.
So then with alopecia,
Mhm.
as you said, there are many causes
Mhm.
of it. What are some of the common causes or what you've seen in your profession for the number of years?
Okay, so we look at dermatological diseases,
Right.
so skin diseases. We look at infectious diseases, internal organ diseases, immunological infections and diseases, endocrine diseases, which is very popular, and psychiatric or physiological diseases. So there are many things that could affect hair loss, and I'll try my best to go in and further break down each cause or reason for hair loss.
Right, because I mean, from a pharmacist standpoint, we do see, many customers coming in to actually show us their scalp, and some of them do experience some sort of balding. You can see probably the edges are thinning out, and even inside,
Yes.
you'd see some spots, some patches, right? And on top of that, you would see some type of flaking. Sometimes the skin is broken, and that's why I said at the beginning it may be a combination of factors
Yes.
that causes the balding or the breakage or the thinning of the hair. So when it comes down to what has happened, all what you've listed, is it hormonal? Is it an infection that was acquired? Is it physiological? And I think physiological is an aspect on its own that we'll
Yes.
talk about
Very much
after.
so.
And it's a very real thing.
Very much so.
And if someone is suffering from, let's say, PCOS,
Right.
or has some sort of other type of hormonal imbalance,
Like men with high testosterone levels.
exactly, they can experience
Hair loss.
hair loss as well. So it's not just for the ladies.
No. Children
Men,
as well.
right? So but what do you see as the most common cause for you in your practice?
Okay, so let's look at the types of hair loss. So we looked at what could cause it.
Right.
And in the salon or even in the clinic, well, I see them in the salon before I see them in the clinic. So in the salon, the most common ones that I see are telogen effluvium. Okay, and so that is the physiological type of hair loss. And so whenever someone is under a lot of stress or went through a very stressful situation, it affects their hair cycle. And so, two of the factors that we look at when someone is going through a stressful situation is one, are they getting enough sleep?
Okay.
And so the studies have found that the follicles have melatonin receptors, and melatonin is what helps to induce that anagen phase. And so people who study, people who are stressed, people who have insomnia, they usually experience alopecia. And we're talking about the excess shedding part of alopecia.
Right.
Okay. So that's telogen effluvium.
Right.
Okay. The other part of telogen effluvium I wanted to talk about is it's a subconscious thing. So sometimes persons who suffer from anxiety and depression, one of the things we find is that they don't there's not enough oxygen, so they don't breathe. There's always a shallow breathing that happens in people with anxiety. And so that's why when you're having a panic attack, they'll tell you, breathe, take deep breaths to avoid the shallow breathing. So you don't get enough oxygen to those red blood cells, and then you don't get enough oxygen to that microvasculature that is below the skin surface on the scalp. And so because our scalp is at the top of our head, the body has this system where it keeps what is there for the vital organs. And so most times you find things like your nails, your hair are the ones that usually show the effects of whatever it is you're going through, if it's anxiety, depression, and so on. And so that is one of those that I see. So usually when a client comes in the salon and say, Shams, my hair shedding, I don't know what to do, I ask them, over the chair, I ask them, anything happened recently? Are you sleeping? Did you change anything? Do you suffer from depression, anxiety, panic attacks, which is very important, which is very common? And so that's where I start.
Of course.
The other thing that I see a lot of in the salon is traction alopecia.
Okay.
So traction alopecia is very, very, very common in the Black community. And I mean, I don't think there's one person in Dominica who hasn't seen traction alopecia or can't identify traction alopecia. And that is because it's a cultural thing. Okay. Now, what is traction alopecia? So traction alopecia is hair loss that is induced by tension and force on the hair follicle. And it's not something that happens one time. So let's say you put in braids today and you will get traction alopecia. It has to be a consistent tension and force on the follicle. So now each follicle has a muscle attached to it, and that muscle, its purpose is to hold the hair into that position. And well, in some areas, of course, to rise and drop. So when you shiver or you feel something close to you, your hairs will stand up. So the muscle is responsible for that. So it's also responsible for holding that hair in place. And with traction alopecia, the tension and the force, the muscle is unable to keep that hair there, and so it is prematurely pulled out. So it's called traction, the tension alopecia, which pulls it out. And the most common presentation amongst our Black women is the loss of their hairline. So a lot of women don't have hair in their hairline. Or you can see it manifest over the ear and at the nape of the neck.
Right.
Yes, so these are the most common places we see.
I'm really going to say here that I smiled throughout that entire explanation because it is so common.
Very.
And the interesting thing, the sad but interesting fact is, you would see someone suffering from traction alopecia, and they would still continue to install hairstyles that pull, like you said, on the follicles.
Very much so.
And I say they probably don't realize the extent of damage that they're doing.
Most times they don't.
No, but you see, when you really see it, when you take a break from the styles, so the weaves, the braids or whatnot, and you probably try and put your hair in one, and you're looking to style
Your
the
edges.
edges, but the edges are not there.
Very much so.
You know?
And then the thing is that one of when people come in with, oh my god, my hairline is gone, what can I do? And the first step in recovering or recuperating your hairline is to remove the insult. So before I would ever recommend putting any oils or any concoction or serum that was made, I would ask that you no longer cause insult to the area, because this is what is causing the hair loss. And what some people do is that, okay, they say, okay, you know what, I lost the hairline, so I'll leave out the baby hairs and I'll do it behind. And then they lose what's behind. And so that is why some people end up with almost 3-4 inches of hair.
retraction. Oh,
That's it.
gosh.
And so that's what happens. So the first step to treatment for traction alopecia is to remove the insult. So
Right.
you no longer wear those types of styles.
But hear this. There's a popular saying, beauty is pain.
Yes,
And so
in the black community.
very much so. And so many times when you see those lovely, beautiful hairstyles and the braids are super, super neat and small, we feel the pain.
Mhm.
I saw a video recently on TikTok. I mean, they were micro braids. First of all, that's a lot of patience. But and when it was done and they were trying to style it,
Mhm.
the customer was literally in tears, because you can imagine having so many micro braids. So you really have to get every little hair
Mhm.
to put into that braid.
Mhm.
And putting it into a style, you're putting extra pressure at the root.
Mhm.
And she was in tears, and I said, "That's wicked.
Is the style even worth it?
Is it worth it?" Because
Yeah.
at the end of however long she's going to have it installed, you can imagine the pain and probably the damage. So whereas should like to see hair growth at the end, she may have done so
The
much
opposite.
damage, right? And then the pain of uninstalling can also be very painful as well. But what I would advise us as ladies, especially, is when we're having styles, installed, whether it's braids or weave, because they are the sew-ins, right? That we can't speak up and let our
Very much so.
hairstylist
Very
say,
much so.
it's a bit too tight. You're not only thinking about the outcome or the end result, but you're talking about the health of your scalp as well. So you can't speak out about it.
Well, that's something that we have to work on a cultural level. I'll tell you, because when I started doing hairdressing professionally, I really had a hard time reprogramming a lot of my customers. And so braids, I don't offer that service. They know I don't offer anything that puts or compromises the hair. I don't. My focus at the salon is treatment. Even relaxers, culturally, when you get your hair relaxed, they will say to you, if it's not burning, it's not ready. And let me tell you, I had a hard time, reprogramming the minds of the customers that, this is a very serious chemical that we're using. And it has very specific instructions in the application.
Right.
And so relaxers got a bad rap over the years because of improper application. And I think too because it became readily available to anybody on the shelf. But there's a processing time for relaxers, which is very important, 15 to 20 minutes, and you take it out. And because of the ingredients in relaxers, the sodium hydroxide, and the microvasculature on your scalp, whenever you get a burn, you create a pathway or an open door for that to get into your system. And so that is why one of the reasons Black women are higher in ratings for persons with fibroids and PCOS and cervical cancer, and so on, due to relaxers, is for that reason. And so again, it is on a culture. Like I've lost customers who told me that it wasn't relaxed properly because it wasn't bone straight.
Yes,
And
yes,
no, leave it
yes,
still.
yes.
It's not burning yet. And I'll tell them, but it's not supposed to burn.
No.
You know, and the duration of the time of the relaxer in contact with your skin has to be shortened to less than 5 minutes. But people put on relaxers and they sit with it, they do house chores with
Yes,
it,
yes,
and then they
yes.
wash it out.
Shoma, I really think, I don't think it's I'm the only one, who's really intrigued by what
Yeah.
you're saying, because I relax my hair as well. I have relaxed hair, and for many years now, and exactly what you're saying, I would be guilty of. I say,
Yes.
okay, then me spray on a little
Yes,
something to
yes.
make it last a little longer because I want it bone straight.
Yes, that's
But
it.
then with recently, with reading, I realized, but there is actually a timer.
Yes, very much so.
So
15 minutes, 20
right.
minutes max, depending on the texture of the hair.
Right. And I realized that the health of the hair improves when you actually stick to the
That's it,
timing.
very much so.
Because you're doing more damage to your hair, and then, like you said, you may compromise the scalp
As
health
well.
as well. So I'm really grateful that you're bringing up those
Yeah.
crucial
And a
points
lot
here.
of the women who suffer with traction alopecia also are relaxed, so they kind of go hand in hand as well. So you have overprocessed relaxed hair, you have damaged follicles because you've burnt the scalp, and then you have they call it protective styles, which is quite the contrary. It's not protective at all. So they do braids and then they get the damage. And then there's also the aspect where they get the contact dermatitis, atopic dermatitis, because they use products like Red One and gel and so on. And that causes an inflammatory response on the scalp. So that they also lose the hair that way.
Okay, so then now we're delving into a whole other category about contact dermatitis and
eczema.
Right. Okay, so there are a wide range of products on the market for a wide range of conditions and whatever you may want to do or achieve. But same thing as the skin on your hands, your feet, your chest, wherever. The scalp is similar in that it would react differently to different products.
Yes, very much so.
And sometimes you may buy a product or apply to the scalp, and you may get a tingling sensation or burning sensation. You may realize your scalp starts to itch. You may see some redness. You may see some blistering. And that is an indication that there is some type of contact dermatitis. Dermatitis meaning inflammation of the scalp as well. And that product needs to be seized immediately.
Very much so.
And of course, try a different type. But I will say this, before venturing to another product, if that scalp condition is not treated properly first, you're actually causing more harm
Very much so.
than good when jumping to another type of product that may even worsen the situation
Very much, yeah.
or do the same damage as the previous. So it's always wise to treat a condition first, and then you can say, okay, let me see if I can try something else. What you've seen, I mean, even from Dr. Warren Sanford, who also writes prescriptions for skin conditions, scalp conditions as well. We've done numerous compounds just to try to target exactly what is being presented. And like you, I'm sure he would have to ask them many questions as to what may be causing it, how long they've experienced it for, what have they tried already. And you see that particular question, what have you tried already? Because it gives us an idea, okay, this did not work for you. It may be appropriate for someone else for the same type of condition, but probably you've had it for so long and the condition has progressed,
that's true.
Right, that you may need a different type of mixture made.
A different formula.
Yeah. Unfortunately, what we have seen is that sometimes persons are not as dedicated.
They're not compliant.
In
That's the number one
treatment.
issue that we have at the clinic.
Right.
And so any new customer that comes in, in the salon.
Mhm.
We do an over the chair consultation. And majority of the times I can tell what it is before I even ask because the presentation is usually the same.
Right.
And so one of the top products that I have declared war against is the red one. So
Oh, we try not to bash any particular,
no,
but
listen, the product in itself does absolutely nothing other than a styling product. It does nothing for the hair. So I always ask customers when they come in, it's usually after they've seen that there's an issue, they've tried everything, it doesn't work. And so they come in and they ask, okay, what's going on with my hair? What can I do? I've used this oil, that oil, and nothing works. What can I do?
Mhm.
And so, based on the feel, so I do a touch.
Okay.
I can tell, okay, this person has used a product with a very high percentage of alcohol.
Yes.
And so the alcohol affects the hair and it affects the skin. Some of these products are even keratolytic, so they break down the hair fiber. So you find with any sort of tension, so you do a tensile test. Any tugging on the hair fiber, it bursts
Easily.
very easily.
Yes.
So it breaks down those proteins that or the disulfide bonds that help to keep the hair fiber
Right.
strong.
Okay.
And so it's a product that I don't like. Some customers do a lot of gel, and so the hair is very dry, very brittle. So if any combing, brushing their hair, it breaks. And so that over the chair consultation, it's easy to kind of get an idea of what they've been using. So people, they try and they come in and their hair is heavy with oils.
Yeah.
And I always try to educate clients or customers that oils are not so much for the hair fiber,
Okay.
especially natural oils, essential oils. And that is because the molecular structure of the oil is too big to penetrate. So we use, there's some product lines and they're usually more expensive. They use
Right.
hydrolyzed oil. So they
Okay.
break down those
So
the molecular structure so it can be absorbed.
okay.
But our essential oils are more beneficial on the scalp
Okay.
because the skin absorbs it.
All right.
So it takes it to the follicle.
So some examples of essential oils. 'Cause I'm sure someone listening is like, how do I know if the oil that I'm using is an essential oil?
Usually it states on
On
the
the
packaging.
packaging?
Yes, it states on the packaging. But some of the more common ones are the coconut oil. And if you buy locally, because sometimes they say coconut oil, but it's a synthetic oil or it's a mineral oil. And mineral oils are not the best. So coconut oil, castor oil, rosemary oil is very popular, tea tree, peppermint. Those are our some of our main essential oils.
Okay.
And each has its purpose and its function. Some are for stimulation, some are for antifungal, antibacterial, some are sealants. So you have to know what oil you're using for what.
Right.
Yes.
Because from what I've read, like coconut oil is one of the oils used as a foundation to many mixtures because it gets absorbed easily as far as I
Yes, and in the hair as well, and that is because the molecular structure of the coconut oil is similar to that of the hair fiber. So it's
okay.
easy to recognize it and draw it onto
Draw it
itself.
in.
Yes.
Okay, nice.
Right.
But before our time runs out, I really want to go into other forms of diagnosis.
Right. Yes.
Other than just seeing visually. I know that there are certain tools that can be used, and more importantly, other treatment options.
Yes.
So let's speak a little about the diagnosis
Okay, so
aspect of it.
at the clinic, one of our main tools we use as a diagnostic tool is the dermoscope.
Okay.
So what a dermoscope is a handheld digital microscope. So we use a microscope to view some structures of the head. So we are viewing the hair shaft, we are viewing the follicle, we are viewing the skin of the scalp, the surface of the scalp, and we are also trying to view the vascular structure of the skin. Okay, so it's a microscope that we use to see what the naked eye can't see.
And that's a dermoscope?
It's called a dermoscope.
Okay.
Now, the procedure is called trichoscopy.
Okay, right.
So trichoscopy is where we take you through that process.
Mhm.
Okay, so we view, we analyze, and sometimes it's easy to diagnose a scalp condition with just trichoscopy.
Okay.
Other times we have to include other clinical interventions. So we may ask you to do some blood work. We may have to do a biopsy. What else? But all that in combination with the trichoscopy, because that is where it begins. That's where you see the first signs of an issue with the scalp or the hair.
Okay.
Okay.
So it goes beyond just visual analysis
Very much so.
sometimes,
Very
right?
much so.
And again, even at the pharmacy as well, someone may come in with a certain type of presentation on the scalp, and there'll be a lot of flaking. And it may be as a result of what you have spoken about. Probably a product has caused it. Probably not enough moisture at the same time, so you have dry scalp associated with it.
And autoimmune disorder.
And autoimmune disorders as well. So I'm very happy that we bring up the point that it may not be something on the surface, a problem just on the scalp. So it may stem from within,
A systemic
right?
imbalance.
And then the only way to really know is to do some tests.
Yes.
So whether it's hormonal, whether there has to be a sample, of what is being presented to be tested under the microscope and see what else is there, and a list of other questions that will draw us closer to the true cause of
Yes.
it. In your practice, I mentioned earlier about transmission from barber's tools from one head to the next. What about sharing at home? So your combs, your brushes. Have you seen a transmission or health cap problems just because, let's say, I'm sharing my sister's combs and brushes or family members that would progress into other types of skin conditions from one person?
Definitely. So, well, the major one is called tinea capitis. So we call it ringworm.
Right.
And that's one of the most common ones. The other one that we see from the barbershop is folliculitis. So tinea capitis, because it's a fungal infection, if I am currently experiencing that fungal infection and I'm using my brush, my comb, and you use my brush and my comb, because it's opportunistic, whenever there is any opening, any scratch, any bruise, or let's say the pH of the scalp has been altered, then that creates the perfect environment for you to also get infected.
All right.
Yes. Now the other is with the barbers and folliculitis is more on a sanitation or sanitary level. And so have you ever noticed the men with the bumps in the back of the head?
Yes.
Yes.
Almost
So-
on a daily basis they
yes.
come in. Yes.
So it's called folliculitis. Well, it's one of the types of folliculitis, but it's most common in men and black men specifically. And one, it has to do with unsanitary tools that I use from one person to the next, and so the infection spreads. And because barbering, you're using sharp tools. Some barbers use razor blades, they use
Scissors.
T-outliners, they use right. So some men will get an infection. And that infection, it presents usually as a pustule. And then the other thing that they get is ingrowns as well. So it's a combination of things. And most men don't pay much attention to it. They just figure, oh, well, it is what it is. But once it gets infected, then it further progresses. And so you get scarring, and some even end up with what we call keloids. And then once it gets to that, then it's very difficult to reverse.
Right.
So-
Right. So I mean, it's a collection of factors that we really have to take note of. It's not just I wake up and a bump appears. There must be a root cause to it. And I think we really should take pride, in our scalp health, not just women but men alike. And now and then pass your fingers through, open your hairline if you have long hair, of course, and see what's happening, see what's occurring. If you realize you have this reoccurrence of some type of skin condition or flaking or blistering of some kind, have it addressed
Yeah,
as
because
quickly as
the
possible.
thing is, I try to encourage people to consider scalp health and hair health much as your body,
Of course.
because you're shedding scales on your scalp, which is what we call flicking, just as your body, but you wash your body every day.
Right.
And some people go like weeks without doing a shampoo. And so what you do is you end up creating an environment for bacteria, malassezia, or fungus, which is what they feed off of. And we get the itching and the flaking, and we pay no attention. And that's why trichoscopy is very important, because we look at things as the distribution of the scales,
Right.
the color of the scales, if it's perifollicular, because even that too in itself it helps us to look at other disorders of the body.
Right.
Look at lupus, thyroid disorders, hormone disorders, based on the distribution, not of just the scales, but of the hair loss on the scalp at a
Right.
microscopic level. So the more you keep a healthy scalp environment, the better it is to mitigate some of those disorders that may progress into something that we can't come back from,
Right.
like scarring alopecia, CCCA. It's a very long name: central centrifugal cicatricial alopecia. And so it's a scarring type of alopecia that we can't come back from.
Right.
And so, unless we start, changing the way we approach hair, we will continue to see a lot of hair. And I mean, we're seeing it in children, babies,
Of course.
adults, men, women, when hair loss really was a thing that was reserved for age, mature age, older age. But now we're seeing it in people as young as, children as young as 4 5 years. And so it begins, of course, with scalp health.
Of course. So personal hygiene extends to the scalp and
Very
hair.
much so.
In terms of treatment, because we need to have a little time to
Wrap up and
so we
take
can
the callers.
right. In terms of treatment, what are the best options that you have seen or available? Like I know it's about Jollies, but
So there are a lot of treatments available.
Right.
There's a plethora of treatments that
Right.
are available. But you choose treatment based on the condition. And so stimulation therapy is one that is more financially available and can be done at home.
Right.
So stimulation therapy would include massaging with oils.
Right.
Stimulation therapy can also include microneedling. It can include low-level laser therapy,
Right.
minoxidil, rosemary, and rosemary oil. And there's another oil that are known to induce growth.
Right.
Rosemary and peppermint
Right.
are known to stimulate and induce growth. So stimulation therapy is one. There are other therapies like PRP and PRF, which is platelet-rich plasma and platelet-rich fibrinogen. So we draw the patient's blood, we spin it down and centrifuge it, and then we take the platelets, which have a lot of growth factors, and we inject it back into the scalp. There is also mesotherapy. So mesotherapy is we use a small handheld machine that works almost like a tattoo gun, but what it does, it induces very small punctures to the scalp, and we infuse exosomes, which are stem cells, to help regenerate that hair growth. So these are, if I'm not,
So you
and
mentioned
steroids. We do steroids as well. We do enzyme blockers like minoxidil, finasteride, dutasteride, Propecia. We use these as well to inhibit enzymes that would cause, for men specifically, and women who have high androgen levels,
Right.
like women with PCOS who experience hair loss. We use those to inhibit the 5-alpha reductase, which is
Right.
what is responsible for converting testosterone to dihydrotestosterone, which in turn attack the follicles and leads to miniaturization and hair loss.
Wow. It's a lot to take in.
A lot.
Certainly.
Hair loss is a very, very
Yes,
complex.
It is.
Yeah.
Some of the terms that you use, like the minoxidil, finasteride, dutasteride, to do with the
Stimulation.
or whatnot. I must inform our customers that you are not able to just come over the counter
No.
to ask for those. They need to be prescribed.
Very much so.
And so after evaluation with
Very important to
Shoma,
know.
and the proper diagnosis, then she would refer you, to a specialist and whatnot, that can write a prescription for those. Minoxidil, we do have that over the counter. We should have our choice right now. I have to cross check, but we should have minoxidil. It's a very popular
Very.
option, and I must say that I've seen results. Looking also on before and after and whatnot. The essential oils which you mentioned, the peppermint, the rosemary, coconut oil, and so forth, those are readily available
At Joy's.
at Joy's Pharmacy. Thank you.
But the fungals, the antibacterials.
Right. So again, like you said, based on the scalp condition that may cause thinning and shedding and hair loss, once they are properly diagnosed, they will be treated accordingly. So if it's a fungal infection, we have the antifungal agents. Some of those can be picked off on the OTC aisle. We have things like ketoconazole, clotrimazole, miconazole, and the list goes on. If it is a mixture of a bacterial infection and fungal infection together, there are mixtures that can be
that
done.
can be made.
Right. If it's eczema, again, there's also options for that. So many of the options are available without a prescription, but other options like laser, steroids, microneedling, would have to be done
Mesotherapy.
professionally.
Yes, we do at Advanced Holistic Wellness Clinic on 3 Jewel Street, Roseau.
Okay, and I'm guessing you'll give your number.
I definitely will.
Right. So at the beginning of the show, I did mention that there will be 6 lucky customers who will be able to have a free consultation with Shoma on Friday and Saturday at Jolly's Pharmacy. So what we will do, and I'm hoping that you will listen in, and that we will take a short break, and when we come back, just to close off, we will allow our callers to call in with some of the very easy questions.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango, with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun with your daughter or with your son. We cater to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Bring papa and mama along. We cater to everyone. What a happy place.
Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. That is JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun.
Welcome back. Welcome back. And we are on our final leg of our show of Health Vibes for this morning. We got quite a wealth of information from Ms. Schumer Alfred, who is a specialist and expert in her field of study. And for the ending of our show, for those of us who were listening attentively, um, we'll be giving out 6 giveaways. So for free consultation. So very easy, and I'll give you the numbers to call in. Okay, so I'll give the numbers first. So 449-3095, 449-3096, 449-3097. If you call in, well, if you're abroad, I guess we can do over the phone consultation. But it's 305 432-9624. Okay, so we mentioned very early what Miss Schumer Alfred is. So there were 2 categories, two areas of specialties that is under her belt. And if you can at least define what one type is, then that will be a giveaway. We also mentioned different types of infections that can cause hair loss or hair shedding. I mentioned it just before we went, or before we took the break. And then third, not least, not last, there are different reasons as to why the follicles of the scalp can be affected, or what it can be affected by. So it's not just about topical reasons, can be other reasons that stem from within. And then last but not least, to name at least 1 or 2 ways that scalp conditions can be treated. So I'll go over them again. So Miss Schumer Alfred was introduced, and she is dash and dash. Or if you cannot remember the terms, at least what she specializes in. I also asked what are some of the skin infections that affect the scalp, what can be used to treat. So whether it's an oil you want to mention, or a type of therapy that can be used, and what may also affect our scalp health. So I think those are very easy questions.
Very easy.
Nothing to hurt your head about. So again, the numbers are 449-3095, 449-3096, 449-3097. If we don't get all the callers, and 616-4257. What time on Friday would it be?
So we'll be there from 8 a.m. to 12 p.m.
And that's at our main branch.
I believe they said 2 locations, but the main branch for Sutton.
Right. So on Friday and Saturday from 8 a.m.
to 12 p.m.
To 12 p.m. You can find Miss Schumer Alfred. We may have to change the category if we do not get any callers this morning to answer. So who would be probably the first 10 walking in, or first 3 walking in.
Yes.
You may get them the free consultation. But what is your fee on a regular?
So at the clinic, we charge $100 for the consultation, and it also includes the trichoscopy.
All right. So thank you for that. And your telephone number.
And so our telephone number is 265-4552. Or you could visit us on 3 Jewel Street. That is the lane behind Lafayette and Wesley High School. And our clinic is Advanced Holistic Wellness Clinic. Or you could also reach out to us on the website. We do consultations via the website as well. It's waitukai.com, WAITUKAI.com.
All right, so there you have it. One more time for the telephone number. I'm sure someone may be running to look for a pen.
I know. So the contact number for the clinic is 265-7551.
All right, thank you so much. And if anything, you can always call us at Jolly's Pharmacy.
Give them the other number. Sorry. And there's another number. It's 265-4552.
All right, thank you for that. So we're going to give at least another 2 minutes. We're borrowing time from Q95 right now. and see if we get any call-ins. If not, then like I said, probably the first few walk-ins will get their free consultation on Friday and Saturday. But I'm hoping that this session was very educational, informative, and eye-opening. I can speak from a personal standpoint that some of the information that you shared, I was not aware and had that misconception that certain types of practices will actually doing more harm than good. And it's always good to have professionals, educate you and to mitigate any misinformation that you have been practicing,
Yes.
for so many years. Like Ms. Shema Alfred said, our scalp and hair health should be as important as the rest of our
Overall
body,
body, yes.
health. And it's part of our appearance, so as much as possible, if we maintain healthy practices and we do what we need to do, then we will have flourishing long hair, healthy scalp, and so forth.
Yes.
Any closing, we have a caller? Okay. Good morning.
Good morning. I'm trying to reach Q95.
Live.
Excuse me?
This is Q95 Health Vibes.
I'm not hearing what you're saying.
Okay, so this is Q95 on Health Vibes.
I want to call online. On here, sorry.
Right, you are live, so you can go right ahead.
Oh, okay. All right, let me call back and load on my radio.
Okay, thank you.
She probably wasn't hearing. She took up the
You
time.
could hear me?
Yeah, I could hear you. But
Okay.
she said she's going to call back.
I don't sure.
Okay.
But, yes, Miss Shema Alfred.
Yes.
So thank you again for being on with us. Any closing remarks as to general hair health and stuff?
Okay, so two things. Again, I want to say a special thank you to Jolly's Pharmacy, Orin and his team, namely Miss Carrian and Malcolm and Mrs. Fagan. What's the last one? Defoe. Okay, so I want to say a special thank you to you guys and Q95 for hosting me. I really appreciate any opportunity to spread, knowledge and information about something I'm very passionate about. So thanks again, and I hope to be back sometime soon. And I also want to encourage persons to visit our clinic. My business partner, Miss Dr. Shane McIntyre, he's a general practitioner and a gynecologist. And so we work together at the clinic. So feel free to visit us. We have a very lovely receptionist, Gail Parilon. She is amazing and she will be more than happy to answer any questions that you have. Okay, so thanks again for having me.
All right, thank you so much. Thanks for tuning in. We will be back next Wednesday, God spare. Please do enjoy the rest of the day and enjoy the rest of your week. Take care. Bye-bye.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes every Wednesday morning on Q95 from 10 a.m. to 11:30.